Welcome, everyone. Good afternoon. Thank you so much for joining us for today's webinar on ending HIV, why caring about ending HIV equals caring about sex ed, the latest edition of the SIECUS If Then series. We're going to give everyone a couple of minutes to settle in. So please just give us a couple more minutes. And in the meantime, if you want to introduce yourself in the comments, who you are, where you're living, please do so now. Thanks. Welcome, everyone. We're going to get started in just a few more minutes. Let everyone get a chance to join us. But we are excited to have you for this latest webinar. Welcome, everyone. We're going to get started in just a few more minutes. Please do introduce yourself in the comments. Great. Welcome, everyone. We are so glad to have you. Please do introduce yourself in the comments. We're going to go ahead and get started. I'd like to welcome you to our webinar today, Ending HIV, Why Caring About Ending HIV Equals Caring About Sex Ed. This is the latest in our If Then series. And so if you're not familiar with the SIECUS If Then series, let me tell you a little bit more about it. The SIECUS If Then series is a cutting-edge periodical publication where SIECUS collaborates with leading experts across various fields to delve into the intricate interplay between sex education and pivotal social issues. By connecting the dots, each edition highlights how quality sex education is a powerful tool for social change, illuminating how it intersects with, supports, and enhances movements dedicated to health, freedom, and equality. Through expert insights and collaborative exploration, the series fosters a deeper understanding of sex education's role in addressing some of the most pressing challenges of our time, encouraging readers to see and support sex ed as a cornerstone of the progressive social transformation. This event is being live streamed, so we're going to just go ahead and get started. And like I said, please do put in where you're from and what brings you to the webinar today. We have a robust program, and I want to make sure there's plenty of time for you all to ask questions. So first, let me introduce myself. My name's Allison Macklin. I'm the Policy and Advocacy Director for SIECUS, and I will be the panel moderator for today. Before we begin, a couple of housekeeping items. As you know, we're using StreamYard, and this webinar is being live streamed. Please feel free to chat in the chat function per usual, like you would on a Zoom call, but remember that all audience members can see this chat. We do encourage you to use the chat function to ask questions and engage in conversation with each other as well as whether you have questions for the panelists. We do strive to keep this space safe for all speakers and participants, and we will not tolerate any disrespectful or harmful language, and have content moderators in place to remove anyone who uses offensive slurs and or harassing language. You can enter your questions in the chat at any point, and then our content moderators will be collecting them, but they'll be addressed at the end of the discussion. If we're not able to get to your question today, please do email SIECUS at info@siecus.org. That's info@siecus.org with your question, and we'll pass it along to the speakers. Again, this webinar is being recorded and will be made available to all who registered for the event. We will also be posting the recording online, and it will be made publicly sometime next week. Thank you again for joining us for this webinar on ending HIV, why caring about ending HIV equals caring about sex ed. Let's go ahead and get started. I'd like to introduce you to our panelists today. First, I'd like to introduce you to Sydelle Barreto. They are the Assistant Director of Federal Policy here at SIECUS, Sex Ed for Social Change, where she helps to fight for a world that is marginalized, and fight for a world where the marginalized are affirmed in their identities and have the power and information to make decisions about their own health, pleasure, and wholeness. Sydelle received their BA in Political Science and Economics from Northeastern University and their MA in Philosophy and Social Policy from George Washington University. Welcome, Sydelle. Next, I'd like to introduce Ciarra Covin with the WELL Project. Ciarra Covin is a maternal and family wellness human services advocate dedicated to advocating for the autonomy of women living with HIV and their families as they navigate the lives they envision for themselves. She is both professionally and personally committed to advancing the dialogue around HIV and breastfeeding. As a woman living with HIV, Cici was able to advocate for support from her providers to breastfeed her youngest child for 7 months. In the role of Senior Manager of Community Programs at the WELL Project, Cici has been able to leverage her voice and experience to advocate for parents living with HIV. Welcome, Cici. And finally, I'd like to introduce you all to Mackenzie Flynn. Mackenzie serves as the Policy and Annual Conference Manager at AIDS United, where she supports our AIDS Watch and AIDS Watch at Home events, as well as the sexual and reproductive health policy portfolios. Outside of work, Mackenzie is a part of Advocates for Youth Abortion Support Collective, and is a board member of the Healthy Teen Network. Mackenzie has over 5 years of experience in the public health and social justice space through working in Washington, D.C. and her home in South Florida. She holds a BA in political science from George Washington University with minors in public health and sustainability. Welcome to all of you. Well, I'd like to go ahead and get started because we do have a number of really great questions to ask y'all. And Mackenzie, I'm going to actually start with you. Please tell me, what do you see as the current challenges and gaps in HIV/AIDS policy, particularly in terms of education and prevention efforts? How can policy better address the intersectionality of sex education and HIV/AIDS awareness, especially for vulnerable populations?
Yeah, I know something that we talk about in this one pager, and that's something that's talked about throughout the If Then series, is how sex education is central and integrally linked to HIV advocacy. And that means that all individuals, including people living with HIV, have the right to make informed, autonomous decisions about their sexual health. But for people living with HIV, these decisions can be more complex, involving medical decisions that can drastically reduce the risk of transmission during insemination, pregnancy, childbirth, and infant feeding, as well as criminalization. When it comes to some challenges, I think about how sex and HIV education cannot be standardized because it's a local issue that's often decided upon at the school district level. And the US has more than 14,000 public school districts. Alongside that, decisions around sex education can even go beyond the district, falling to school administrators and educators who often don't receive proper training on the topic. which poses another challenge. And this is all conflated by current efforts to pass anti-LGBTQIA plus legislation, which may further limit not only what people can talk about, but what people feel comfortable talking about in schools regarding gender identity, sexuality, and HIV. Regarding some gaps, I think about how crucial lived experience is. Now, a lot of individuals, particularly those that we're trying to target, are left out of the conversation, and that includes students and parents. Alongside that, just peer education and peer learning as a resource or avenue for dispersing this information to the general public. A lack of this evidence-based, medically accurate, and inclusive sex education, including information on HIV, prevention, care, and management, can result in stigma, misinformation, unsafe sex practices, discrimination, violence, and stressful perinatal experiences. But when it comes to how to address the intersectionality of sex education and HIV awareness, I know the one pager that we all worked on has a suite of bills in Congress that are moving, but I also think about the state and local level and how we need to fight back against state level policies to limit education on LGBTQ youth and, just sex ed more broadly. But I also wanted to highlight the Well Project and CC specifically, as that organization and CC is evidence that grassroots advocacy from people with lived experience has positive impacts. I'm specifically referring to their updated perinatal HIV clinical guidelines around breast and chest feeding for women and other birthing parents living with HIV.
Thank you so much. Well, Cece, you have been a wonderful advocate. And I'm wondering if you can share what your experience was with sex education and how do you think sex education can be improved to better support individuals living with HIV to reduce stigma surrounding the virus?
Well, my experience with sexual ed, I got a little class when I was in the 5th grade, and they put up on the screen all of, what your body parts would look like if you were to have ever been diagnosed with each of these conditions. I guess it was a scare tactic, but it wasn't enough to keep me HIV negative. So that is about the extent of my sexual health education. I've learned more and more since I've been positive, and I've been positive now for 15, almost 16 years. I got diagnosed at the age of 20, not doing anything different than what my friends or my peers were doing, but I lived in an area where HIV, it was an issue, a big issue at that time, and still is. And just if more education would have been given, maybe I love how Mackenzie refers to that peer-to-peer support. If I would have seen other people that looked like me, if HIV had been made more of something that could have been a character in my story, then maybe I would have paid a little bit more attention. But how it fits into the conversation of HIV is that we should be integrating, and I'm calling straight from the Well Project, She, Her, They programming, which is our sexual and reproductive health programming. Sexual and reproductive health, including sex positivity and pleasure, that should be in all of HIV care. And we see often where those conversations don't meet in places where you would think that they would, specifically in a OBGYN office. And I've had an experience where I can vividly see where there was a missed opportunity for education for not only me as the person living with HIV, but also my partner who is not living with HIV. And that comes along with, the increase in the relationships, positive relationships between client and the patient and the provider. So I'll stop there.
Great. And what sort of things do you think that, when we have inclusive sex education, how does that impact the stigma surrounding HIV virus?
I hope that I heard the question right. So how does it impact the stigma? Well, when we think of, how I know many of my friends, we came in contact with HIV through heterosexual sex. So if there were better tools, if we had been taught about, even as simple as our body parts. I took a class as an older adult, and nobody could really name the parts of their anatomy. And that was very surprising because many of us in the room were already living with HIV, had children, and it just would seem to be an expectation of that point. But when you begin to empower individuals with tools and concepts such as U equals U, undetectable equals untransmittable, that by itself can help decrease the stigma that is felt internally by the person living with HIV and have an outward effect on those around us. Seeing people living with HIV as humans who still have sexual desires and wants and needs helps, frame it in a way that no, we didn't do anything wrong. This is a human condition, and helping to sort of normalize it in that sense, I think helps contribute to that reducing stigma.
Oh, that's great. That's great. Well, Sydelle, I'm going to come over to you now for a question. So tell me, in what ways do you think sex education can be tailored to address the specific needs and concerns of LGBTQ plus communities in relation to HIV/AIDS prevention?
Yeah, so I mean, most obviously, sex education for many young people only covers heterosexual sex. Queer and trans young people are not seeing themselves reflected in the sex education that they're receiving. And like Cece mentioned, if you don't see yourself in your sex ed, you might think, this doesn't apply to me. This isn't relevant to me. This doesn't reflect my lived experience. We also need culturally responsive sex education. HIV has a disproportionate impact on Black and Latinx men, and we need inclusive language, diverse imagery, and real life examples that are going to resonate with those communities. A lot of those communities, trans women, Black and Latinx populations, also really struggle with, medical mistrust and racism when they're going to seek, sexual and reproductive health and education. So I think that is something that needs to be addressed both on the education front and then also in terms of when they're seeking services. Mackenzie mentioned, Cece mentioned U equals U. So that's a really important concept that is not really taught in many schools. And education around PrEP and PEP, even how to get tested, what to expect when you get tested, what are the clinics in your area that are going to give you LGBTQ friendly care? Those are really great questions that a lot of young people are going to have in their sex ed that their education probably isn't answering, and if you don't know, even if I have to use a condom when I have sex and that's going to keep me safe. There's so many other safety measures and ways to access resources that young people may not be aware of. And both Cece and Mackenzie touched on this a little bit, but in many schools, HIV is still taught as a gay disease. I was in high school in the 2010s, which is not terribly long ago. And it was still taught as a gay disease, for people that were going to high school around that time. Realizing that anyone can get HIV/AIDS, and it's not about, your sexual orientation and your identity, it's about keeping yourself safe, can be really game changing. And I think lastly, recognizing like the intersectionality of identities and experiences within the LGBTQ communities. So including, things about race, ethnicity, class, disability, and we need sex education that's tailored to the unique needs and concerns of those populations, and also people who are belonging to multiple marginalized groups.
Thank you. Yeah, I think you really highlighted, how inclusive sex education can really contribute to reducing some of those disparities in HIV/AIDS transmission rates among the different groups. So I appreciate you speaking to that. Mackenzie, I'm going to come back to you. So how do you think policymakers ensure that HIV/AIDS education and prevention efforts are accessible and culturally sensitive to diverse communities, particularly those disproportionately affected by the epidemic? So, and then to elaborate on that, what role does community engagement play in shaping effective policy responses?
I really want to piggyback on what Sydelle was saying about that tailored guidance, whether that includes, but it's of course not limited to, advocacy, education, and lessons learned from other movements. And I'm I know we talked about U equals U. Another concept that's really popular within the HIV/AIDS space is called MIPA, which is the meaningful involvement of people with HIV and AIDS, which is all about ensuring that the communities most affected are involved in decision-making at every level of the response. So by identifying the gaps in resources available for folks to make decisions about their bodies and evidently their healthcare, we can give folks innovative strategies to address these inequities and to make informed decisions about their health, well-being, care, treatment, and evidently their bodily autonomy that are individualized for the community's not only needs, but their wants. And that means a few things. I know Sydelle referred to youth, and making sure that things reflect them. Relying on young people to spearhead all of this isn't sustainable or feasible. 1/4 of new HIV cases in the US are among adolescents and young people between the ages of 13 to 24, and PrEP engagement among youth and young people in the US is historically really low throughout the country. Alongside that, young people are doing a lot of work on college campuses, at school board meetings, and on social media and online communities alike. Getting other constituents involved, like school boards and parents, is really important in our fight for inclusive sex education. Also, kind of piggybacking on the response from Sydelle, research has really shown that marginalized people are more likely to have lower HIV and PrEP knowledge as a whole. And inaccurate and stigmatizing education really does create barriers to HIV prevention, testing, and treatment for all people, which further perpetuates inequities in care for marginalized populations, specifically and especially men who have sex with men, Black and Latino women, and transgender women. So when it comes to community engagement and that role in shaping effective policy measures and responses, I think about kind of the idea of the series. It's the fact that sex ed is related to everything. And going back to MIPA, the engagement of affected communities is really crucial and critical, especially now. So it's partnering with people living with HIV to make informed decisions about their own healthcare and treatment. It's including them in research agendas that affect them and creating and allowing them to review the policies and programs that directly impact them. It's really important, and it's an important cornerstone in ending the HIV epidemic and in the HIV response. So, we must recognize the important contributions that people with lived experience, CC being an example of that, can have, and treating them as equal partners in everything. You can't talk at people, you have to work with them. And then creating a space within society that, fosters that involvement and that active participation of people with lived experience in all aspects of their response. And when that comes to sex ed, it's not only, the creation of that sex ed and that curriculum, it's also how that's distributed. And, there's layers to it. But yeah.
Thank you. I really liked what you said about, you can't talk at a group. You have to really include individuals of the community in the solution and understanding what are the needs. Not only what are the needs, but what are the wants. So that's really a great highlight. Thank you. Well, Cece, coming back to you. So building off of what Mackenzie has said, what sort of advice would you give to educators and policymakers to improve HIV/AIDS education and support for individuals who have been recently diagnosed? I'm curious how we can foster empathy and understanding within communities to combat the stigma associated with HIV and AIDS.
Oh, thank you, Mackenzie. You said a mouthful then. MIPA, yes, because don't create another program or policy without a person with lived experience at the table. I don't understand how it happens and how it's justified. My advice to educators and policymakers is that when that person becomes diagnosed, they are still a person and they still are experiencing all of those things, those social determinants that they were probably facing, before the diagnosis. Now is compounded with the HIV diagnosis, and it magnifies everything. So I might still be poor, I'm still going to be Black, I'm still going to have all of these other intersections, and those must be addressed. I would also create in that empathy. and compassion within communities, work for the Well Project. And our mission is to serve women and girls who are living with HIV across the gender spectrum and those vulnerable to it. And I love to make the point of, yes, that I'm a person living with HIV, but you then would be the person that is vulnerable to a diagnosis. So I think framing it in a way that we all have a stake in this fight, we all have a stake in the education that is received by us and the generations that come after us. I think that is enough to evoke some type of compassion instead of sort of othering. Once that diagnosis come down, you become a number. Now you have to follow these sets of rules, and taking that away, I think would kind of help with those things. The more advice for those educators is the research component of it all. We need to see more folks that look like us when the PIs are coming around to ask all the questions, or whatever it may be. Just more representation all the way around, I think we'll get a lot further.
That's awesome. Thank you. And I want to highlight the fact that, you talked about this isn't just this is an everybody issue. This isn't just people who have been diagnosed. This is anyone. We are all in this together. And so I think that was I just wanted to highlight that. I think that was really great. Sydelle, I have one last question, and I'm going to point it to you. So how can sex education programs adapt to the evolving landscape of sexual health, including the rise of parental rights movements, censorship efforts, and changing social norms?
Yeah, I mean, I think the first important thing to point out is the parental rights movement, the people that are banning books in school, that are, proponents of the whole don't say gay policy, that are, persecuting transgender and queer students in schools. They are a minority. They're a very loud minority, but they are a minority. The vast majority of parents do want sex education for their kids in schools. It's 8 in 10 parents are supportive of sex education. And I think that those 8 in 10 parents are a population that is often not engaged. These parental rights groups do a really great job of engaging with and getting people who are against sex ed to kind of congregate and use their collective power. But the people that are opposing that, the people that are for sex ed often don't really have that same kind of unification, especially at the state and local level. So I think that's that's a population that I feel is often underengaged. And then secondly, we constantly talk about parental rights. There's so many parental rights bills popping up in states. But I think something that's not talked about enough is the rights of young people. Young people have the right to inclusive, culture responsive, trauma informed sex ed that's going to allow them that's going to meet their needs and empower them to make the best choices for their bodies. And I don't think that parental rights should come at the expense of the rights of young people to education. Also, in terms of censorship, we're seeing a ton of censorship bills, both at the state and federal level, that are going to restrict access to sex education online. Even though post-COVID, a lot more young people are going online to get their questions answered, especially as things are getting restricted in schools. So sex ed needs to also equip students with media literary skills and critical thinking abilities, so they can navigate, the maze of information and misinformation and disinformation that's available online, and quite frankly, might also be in their classroom, and other media sources regarding sexual health. I think we really need to encourage young people to, critically evaluate where they're getting their information from, question stereotypes and biases, and really seek out that credible evidence-based information from trusted sources that is appropriate for them, that, is going to be able to support them to make the choices that are best for themselves and their bodies and their sexual health.
Fantastic. Yeah. I mean, we are all in this together, and I think it's that's a really critical point of recognizing that the opposition is everywhere. So I just want to now take a moment to open it up to our audience to see if there's any sort of questions out there that we haven't addressed yet. So please do feel free to chat your questions in, and we'll take just one moment and pause so that people can type. I don't see questions coming in. Oh, great. There is a question. From the audience, we have, is there a specific resource available to educate adolescents on what their rights are?
I mean, I was the person that spoke about students' rights. I actually don't know that I have like the best answer to that. I mean, to my knowledge, I don't know, like, I know some states have like a parental bill of rights that they're kind of touting. I don't know if something exists like that for students. If not, that would be really cool. And I hope someone does that. I know that, SIECUS Advocates for Youth has resources for young people on how to learn about sex education and get involved as advocates. Even though we may not have a student's bill of rights around sex education, there are ways that young people can go online and learn what sex ed advocacy looks like. So then they can be the ones to write, the bill of rights for young people. So there are opportunities for engagement, but unfortunately, I don't know that there is a list of rights for young people yet.
Also, to kind of add to that, with the increasing political attacks that are happening specifically on LGBTQIA plus folks, I think about how those bills that are created or these guidelines are forever changing. So knowing trusted individuals in this space, I think about Advocates for Youth, I think about SIECUS, these organizations that are doing this work, knowing they're a trusted resource and they'll keep you up to date, but also not being afraid to go and look up stuff as well. Everything's changing, unfortunately, at such a rapid pace on both the local, state, and also on the federal level. So just being cognizant of that as we look at resources and what's available.
And I see some great resources have been put in the chat. So I definitely want to, help uplift those. And we will send those out when we also post this online. But I also would want to say that, that there are, going to the Office of Civil Rights at the Department of Education and really looking at some of the basic rights there. That's also a really good place to start from a student rights perspective. Okay, so we have another great question. What challenges have you all faced when advocating for trans-inclusive sex ed policies, either at the school level, state level, federal level? And do you have any tips or tricks based on that experience?
This is reminding me of something Cece said earlier about how there's this us versus them mentality when generally this impacts all of us. And I think when it comes where you're entering those legislative spaces where people aren't as receptive to your message as one would like, kind of grounding the conversation and reminding them that, this isn't us versus them, this is all of us, and collecting it back to your main goal, whether it's, like making sure people have the correct information that they need to make their own decisions, not necessarily framing it in one way or another, but that people have the resources and tools they need to make decisions and to have bodily autonomy, which is what all this kind of leads to anyway.
And I can jump in kind of from a social media perspective. I do a lot of advocacy there. And what I've learned that once I am equipped with information such as, the use of pronouns or, this cis versus trans conversation, those were concepts that were new to me that I had to be taught. But once I was equipped, I'm able to go back into my community, and it becomes this web of learning. So I don't know if leaders can be identified. I talk often about some trainings that happened at the beginning of the epidemic that I was not yet diagnosed, but the empowering of individuals who, are willing to be out and open and advocates. I think that pouring into them, because social media is how we are reaching a lot of folks and a lot of kids today. So if we could get more of those positive, accurate messages out, I think that that would be extremely beneficial.
And I'll just add, unfortunately, I can mainly speak to the federal level since that's the work that I do. Unfortunately, I do think a lot of lawmakers will see, LGBTQ or transgender in legislative language and will have sometimes just a knee-jerk reaction to it. Even if they maybe agree with the majority of the bill text, that tends to be unfortunately, the most significant sticking point with some policymakers. But I think something that works, or that's effective, no matter how resistant an office is, that you may not get them to, endorse a bill. You may not get them to, endorse your appropriations requests. But I think there's power in sharing your story and people that are directly affected, people who have lived experience. I was at AIDS United AIDS Watch conference a couple weeks ago, and I was part of the New Jersey team because my family still lives there, and I'm still a New Jersey voter. And in the group, we had several trans women, we had a sex worker who were telling their stories, talking about how the policies that existed in New Jersey, the supports for HIV positive trans women, what was lacking. And I think once, policymakers and staffers are, forced to engage directly with the people that are closest to this issue, that are from their district or from the populations that they represent, I think oftentimes that's a really great way to at least start a conversation because, most people are going to react with, empathy and understanding. And, also lawmakers want to get elected again. And these are the people that are going to vote for them.
Awesome. Thanks so much. That was a lot of really great information. So I have another question that is about engaging. And what it is, how do we engage parents who support sex education? How do we mobilize people? And it says in the same way, but I think, I think parents and guardians, how do we mobilize around sex education when we're facing so many challenges?
I can start since I think this question came out of one of my comments. I will say, I don't have experience directly working with parents, so maybe take what I'm going to say with a grain of salt. But I think, groups like SIECUS, like AIDS United, like the Well Project, we have an opportunity to speak to these parents and engage them, connect them with maybe resources at the state and local level. I know Red, Wine, and Blue does a lot of really great work at, state and local levels and engaging these parents. And I think, I remember I recently talked to my parents. There are some really nasty sex ed bills currently introduced in New Jersey, and I was telling them about it. And they were like, if we had, I wish there was something that we could do about it, like this is terrible. This sucks. And, we may not have children in school anymore, but we do care about the other children in our school district and, the children of our friends. And so I was able to provide them with resources of like, you can email your, policymakers and let them know that you do not agree with this policy. So I think it's up to organizations to see parents as a lot of times, I think, as Mackenzie said, this us versus them. We need to see them as potential allies. I think even though the parental rights movement sometimes makes us feel like parents are the enemy, I think it's a lot of like, having honest conversations with parents and engaging and meeting them where they are, to just provide them with like the kind of easiest path and saying, here are 3 different ways that you can engage with sex ed in your area.
And I would add such a beautiful response. And seeing those intergenerational conversations happen, because I've heard recently that the young kids are thinking that HIV and AIDS are a thing of the past and it's nothing that they have to worry about today. And you know, how I know that is not true. Many of them, they're not meeting other people that are living with HIV. We're not seeing a lot of young folks that are out, you know, advocating. So I think empowering the parents and families and guardians to just be able to have regular conversations, allowing a safe space for that child to maybe be able to come to ask questions, to fix some of that misinformation that they may be getting from their friends. Many of them, you know, oral sex is not considered sex for them. So are they protecting themselves in the same way as if they were having like a penetration type sex? Just seeing those conversations and supporting, I think, would help a lot.
And to kind of combine both of those thoughts together, I think about how we need to view parents as constituents as well. When it comes to sex ed, they're really involved. As we talked about, there's all these parental laws and like requirements and all these pushes, you know, kind of leaning on that and seeing where we can mobilize on that. But alongside finding other ways for people to get involved, like Sydelle mentioned, where if you don't have the capacity to go to a meeting because you're working a 9 to 5, you can write an email, you can call your representative. They represent you. If they want to keep their job, they have to listen to you. So that's one way to go about it. But I also think about how, you know, people, like your average people, are not expected and shouldn't be expected to be policy experts. Equipping individuals with the information, resources, and tools that they need that they can amplify to their congressional representatives or just representatives on any level of government is one way forward. And by looking at organizations like the folks on this call, that's one way to do it. But just giving people the information they need. People, you know, want to talk about this and they want to get out and do something. People are being impacted by this stuff, whether it's them personally, their friends, or, you know, the future.
And I saw some comments in the chat of shared frustration that this is that people, or there's a feeling out there that people think that, well, HIV's, that's over with. We solved that. That's fixed. How, aside from sex education, what are some ideas that you have around helping people to understand the realities of what individuals are facing today, that this is still a major challenge, not only in the United States, but globally? That is not the question that's on the, that is just my own follow-up question. How do we keep it front and center?
Continue to have conversations, continue to have those conversations led by folks who are experiencing the experience. Because when we don't, like, just because we don't talk about it doesn't mean that it is going away or that it is not still a threat to the well-being of so many people across the country, across the world. We can't let these conversations die out. We can't let the underrepresented communities continue to be underrepresented because they are there. They just might not have a big voice as other groups may have those big voices, but we are still here. So I think everything begins with a conversation, and the louder that I need to get for you to hear me, I will do that.
Yes, sharing your story, as Sydelle mentioned, is so crucial. And then that meaningful involvement piece, that's truly the only way to move forward. Again, you can't talk at people, you have to work with people. They're your partners, they're not your competition. And Sadie put something in the chat, uplifting the confrontability of those conversations. That's exactly right. Kind of embracing the discomfort and being willing to learn and grow and to propel those conversations forward.
Great, thank you. So we have a question from Chelsea. The school districts are often given a lot of latitude in how they implement sex education. How do you combat arguments that state legislatures should not mandate sex ed and should leave it to local control?
I think I have two kind of, I feel like, more pragmatic responses to this. The first is that state education agencies have mandates around other areas of education. They have standardized testing that all students in the states in certain grades are required to take. And I know, in some states that's tied to teacher compensation and things like that. There's no reason why sex education needs to be treated any differently. Not that I'm advocating for sex ed standardized testing, but that we should hold sex education to, the same standards that we're holding algebra or science. I can tell you that I do not use, algebra anymore in my day-to-day life, but there are definitely lessons from sex ed that are still relevant to me, in my late 20s. The other thing that I will mention is also from a more just kind of practical standpoint is, sex ed in schools is funded by state and federal dollars. There is several federal funding streams that support sex education at the state or local level, and they need to be accountable to either the state or the federal government for how those funds are going to be spent. Obviously, there's always going to be some differentiation at the local level, especially when it comes, there's positive differentiation, surrounding things like depending on the racial population of racial and ethnicity makeup of the particular school district, the class makeup of the school district. There's obviously going to be ways that sex education needs to be personalized to a local area. But at the same time, we need to hold sex education to a high standard, and also, hold districts accountable for how they're using funds and ensure that those funds are being used to actually educate young people to the standard that they deserve.
And so while school makes the most sense because that's who has the kids most of the day and where they learn so many other things, I think that also supporting grassroots organizations which are tackling these issues in your local area could probably be another great way to get that information out to the children and to the youth and adolescents, because you have people out here willing to do the work, and there may be obstacles that stop them from getting into the school, like I just saw in the comments, but supporting the people who are doing the work.
Mackenzie, any last thoughts on your?
Honestly, they both made incredible points. It's either, trying to enforce some standardization, and then if you're not able to do that, meeting people where they're at. There are organizations, there are people that have been doing this work, are willing to do this work, and if we're able to catapult them into an arena where they're able to distribute that wealth of information, those resources, that knowledge to folks, it's so crucial. I know, like, I'm from Florida. The sex education I received was interesting to say the least. And like Sydelle, I'm not really using algebra that often, but I'm using sex ed all the time. And the fact that, I didn't receive comprehensive sex education, there's a lot of organizations doing this work already, and I've kind of had to teach myself through it. Okay, let's open up avenues where we can propel those organizations forward if we're not able to change some of the jurisdiction that's out there now.
Great. And we're getting close to the end of our time today. But I do see one last question, which it's a little bit of what we've talked about already, and I think that, as you answer this, if there's also just, one kind of takeaway point that you want us to leave with today, what ideas do you have to get the general public talking about HIV and sex ed more openly? How do we inspire advocates both with and without HIV? This person has shared that they have been speaking on their own HIV story for over a decade, and it's really hard to get people with HIV to feel safe talking about their story. And it's also hard to get people without HIV to feel empowered to speak out as an ally to the cause. So I was wondering what sort of ideas you have to speak to this question.
Well, I'll jump in. The Well Project has done a great job with the storytelling piece of this. We have a blog called A Girl Like Me, and in that blog, women from all over the world are able to share their stories and share anonymously if they need to, because sometimes you need to keep that anonymity. And then we have another part of that blog called Voices from Our Allies, where people who are not living with HIV are able to show up as allies, and they too can remain anonymous. I would say, as a fellow person living with HIV, I think that we all play our everybody has a role in this. So you have those of us who are going to get out and share stories, those of us who will support from the background. But what I have tried to do over my few years in advocacy is to listen to the stories that I'm hearing, because my ear is so close to the street, and bring those issues and their stories to the forefront when I come to speak, on platforms like this. So realizing everybody has a role, and we might not be able to get as open with the conversation as we would like, but there are communities that are being built out to address these needs.
And I can kind of lead into that. I know that storytelling piece is so crucial, and one of my jobs at AIDS United is, of course, planning our annual conference, AIDS Watch, which fosters a lot of that storytelling and allows the community to determine our agenda, which evidently helps us foster conversations that need to be uplifted at the state, local, and through our whole day at the national level. It's so important to really listen once you're hearing the stories of people, whether they're anonymous or not, due to parameters beyond our control, like criminalization, which is a whole entire different topic in itself. It's so powerful. It's reinvigorating. And, there's avenues where you can get involved. If you're not even to go in person, there's other ways. But I just wanted to uplift that.
I think what's also important to highlight, more from the kind of sex ed angle, is that sex education is an upstream solution to addressing the HIV/AIDS epidemic. It's not going to solve everything tomorrow. It's probably not going to solve anything in 5 years. But by educating young people, giving them comprehensive sex ed to the young people who are in schools now is going to start making a difference 10, 15, 20 years down the road. If we can get future generations educated and empowered, they understand that HIV being positive is nothing to be ashamed of. We're able to address stigma at the root, at the place where it often, develops, because for many young people, the first time that they're talking about HIV is going to be in their sex education classroom. So I think by making changes to sex education today, we're able to change what conversations around sex ed and HIV will look like in future generations.
That's a great point, Sydelle. Thank you. And I've heard over and over again that it's the community engaging, that this is, listening, that we have to personalize this, and then think about that this is something that affects all of us. So a lot of really great takeaways from today's discussion. Just curious if there's any last thoughts that anyone wants to leave us with today.
Echoing your sentiment, we're all in this together. That means meaningfully involving people with lived experience. And in this instance, that's people living with HIV. And just proactively listening, learning, and continuing to grow.
Yeah, and I think I'll just kind of echo what I just said, but I think it's just really important to remember how many areas of our lives sex education touches. It's not just about preventing unwanted teen pregnancy or even just about preventing, HIV and other STIs. It's truly something that teaches young people about healthy relationships, how to navigate difficult conversations, how to set boundaries. And by supporting sex education, we are able to support young people in so many other areas that, are areas that are kind of hot topics nowadays. So I think kind of getting to the root of where a lot of these issues begin is really critical.
And I'm just going to say, keep talking. We got to keep having conversations like this many, many, many more times.
Well said, Cece. Well, thank you all for joining us today. It was a pleasure to have you, and we were privileged to hold this conversation with you all. Please know that you can absolutely access this recording. It will be sent out at later on this week, or excuse me, later on next week, I should say. And please share this information, share this conversation with your networks. And feel free to reach out to us if you have further questions. We would love to connect you with our panelists. And then, of course, check out our latest If Then. It's got a lot of really great information in there, and we are so proud to be in this movement with all of you. Thank you for joining.